Nigeria, with a population of over 200 million people and a weak health system, has managed the COVID-19 pandemic better than some developed nations. To solidify its gains and guarantee global health security, the country is organizing a two-day national summit on COVID-19 in Abuja with the theme Ending the Pandemic and Building Back Better. The Presidential Steering Committee, which is at the heart of the country's COVID management, says Nigeria has invested in enough vaccines while urging more citizens to get vaccinated.
We need to encourage all eligible persons to get vaccinated and to keep observing the washing of hands, wearing of face masks, keep physical distance, and avoid crowded areas. Nigeria has invested in enough vaccines that can cover over 70% of our population before the end of 2022.
And as the virus continues to mutate, America's top infectious disease expert, Dr. Anthony Fauci, says the Omicron variant is still being studied to find out more, as it has the potential to invade the immune system. He also highlighted the importance of vaccinating the world's population.
With a new variant that has emerged, at least recognized first in South Africa, which because of the constellation of mutations suggests a high degree of transmissibility and perhaps some potential for immune evasion of monoclonal antibodies, convalescent plasma, and vaccine-induced antibodies. We will know within a very short period of time whether or not the disease induced by this is severe or not. There are a number of unknowns in this, and the WHO and many countries are paying very close attention to this. Clearly the vaccines work. Their efficacy has been shown in clinical trials and in real-world settings, with a dramatic diminution in infection, hospitalization, and deaths.
While reassuring of adequate and prompt budgetary approvals to battle the pandemic, the National Assembly says it will monitor and ensure the prudent use of all COVID-19 funds disbursed by the government.
In the 2022 appropriation, which is likely to be passed by the 14th or 16th of this month, whatever is necessary will be provided for Nigeria to continue to fight for the pandemic and beyond it. But there is a condition, a caveat, that those who will be given those funds, and that's why I asked for the ministers and the permanent secretary and the agencies, of course, under the Ministry of Health, need to provide the kind of prudence that is necessary. The economy, the efficiency in the deployment and application of those resources.
As the world continues to spend billions of dollars to manage the pandemic, experts say behavioral change is critical, and the issue of culture and environment must be addressed to achieve global health security.
Determination about whether you have an epidemic depends on the people, not on the government. It's the way I behave, the way you behave, that transmits disease. And if people do not look at it and find that, how do I protect myself, protect my family, protect my country? Until we get that into our people, then we'll probably be having problems. The government will be making its own rule, and then people will disobey. And I was saying, we don't trust our government. They lie to us, we also lie back to them. But I think the efforts must be made to let the people know that you are responsible for your health. And disease transmission, you play a major part, not the government.
Despite Nigeria receiving over 30 million doses of COVID-19 vaccines, only 3% of the country's population have so far been vaccinated against the coronavirus. And experts here at this national summit all agree the only way the country can build back better is by getting vaccinated. When eligible Nigerians get vaccinated, as the virus will continue to mutate, and vaccines are the only key to seeing an end to the pandemic. Amaka Udeh, Arise News.